Welcome, everyone. Thank you for joining us today. My name is Congressman Raul Ruiz, and I represent California's 36th District. I'm also a Harvard-educated emergency physician, humanitarian specialist, and public health expert. I'm here today to announce the introduction of my bill, the Humanitarian Standards for Individuals in Customs and Border Protection Custody Act, an all-American value-based comprehensive public health approach to help CBP address the basic humanitarian needs of children and families under their custody and responsibility, prevent the deaths of children, and develop a professional, humane response to the humanitarian challenges at our border. Before we get started, I'd like to quickly thank Leader Steny Hoyer, Assistant Speaker Ben Ray Lujan, CHC Chairman Joaquin Castro, and Congresswoman Zoe Lofgren for their leadership and for speaking today. I also want to acknowledge and thank Chairwoman Lucille Roybal Allard for working very closely with me on this legislation. I want to thank members of the Congressional Hispanic Caucus for their partnership in developing this bill. Dr. LaRue Falusi with the American Academy of Pediatricians for fighting for the health of all children. Sister Quincy Howard with the Network Lobby of Catholic Social Justice for sharing her faith-based values, for standing up for vulnerable children. And I want to thank all the partners and the advocates for fighting for the health and safety of women, children, and families at the border. Last December, I visited our southern border with our Congressional Hispanic Caucus members after the death of Jacqueline Cal Maquin, a 7-year-old who died of sepsis while under the responsibility of U.S. Customs and Border Protection. The conditions I saw were deplorable, subhuman, and heartbreaking. Women, infants, toddlers, and the elderly piled up on top of each other in a cold, windowless concrete room. So many bodies you couldn't even see the floor. Open toilets in crowded cells without any privacy. Visibly sick children coughing on one another. Babies who were dirty and didn't have diapers. In fact, let me tell you the story of what happened while I was there. You see, I saw a petite 4'11" woman holding her baby who was sick with a runny nose, dirty face, and dirty clothes, knocking on the door to get attention because she was asking for a little bit of water for her baby, only to be answered by a 6-foot CBP agent with a rifle holding her back, telling her to go back, and then asking another agent to come and give her a small paper cup of water. Then I looked around that room and went to another holding area and saw another cell with fewer people. It had some juvenile girls and some young women. And then I caught the eye of a young woman sitting on an open toilet, using that toilet. Man, I immediately looked away, embarrassed, really embarrassed that I saw her. And I was embarrassed for her that any passerby could see her, wondering what she felt about the indecency that she was exposed to. Then I walked further and I saw another holding cell with many little boys, faces kind of looking at a 2-by-2 window, also dirty, but looking curious, anxious, and with fear. So at that point, I actually had to step aside from everything and try to hold back my tears and my outrage. And I looked at an agent who was standing there who saw my teary eyes and looked at me, and I just simply said from the bottom of my heart, I said, "This is not right. This is not right." With, you know, when your voice crackles right before you're going to start to cry. Thank goodness I didn't burst out, but I was really that heartbroken. And then I sensed in him a conflicted look as he shrugged his shoulders, looked back at me, and said, "This is how it is. What else can we do?" And I sensed in him a genuine helplessness, a lack of knowledge, and an internal conflict. And I realized that he was right. What I saw were overworked agents and the meltdown of a system that is understaffed, under-equipped, under-resourced, under-trained, and under-skilled to meet the basic humanitarian needs of children and families under their custody and their responsibility. So this bill, my bill, is the answer to that agent's question, what else can we do? And now, more than ever, it is important to implement this answer, because 7 children have now died while in the custody and responsibility of CBP. Jacqueline Cal Maquin, Felipe Gomez Alonso, Juan de Leon Gutierrez, Carlos Gregorio Hernandez Vasquez, Wilmer Josue Ramirez Vasquez, Marie Juarez, and Darlene Valle. 7. These inhumane conditions are inconsistent with our American values and our moral conscience anchored by our faiths. And I'm here to tell you that we don't simply accept this is how it is. Our laws give asylum seekers the right to seek asylum in our country with due process and their day in court. And while they are deprived of their freedom and under the custody of CBP, they are under the legal responsibility of CBP. CBP must adapt to the global humanitarian challenges and realities at our doorstep. That is why today I'm introducing the Humanitarian Standards for Individuals in CBP Custody Act. This bill is based on interviews, numerous interviews and conversations with CBP leaders and agents in the field, humanitarian experts, physicians, and public health experts. It also draws from my own humanitarian experience as an emergency physician and humanitarian Harvard-trained physician, not only at Harvard, but also with the International Committee of the Red Cross, as well as my experience working alongside the U.S. Army's 82nd Airborne Division in Haiti after the 2010 earthquake. These standards also draw from humanitarian principles described in the Sphere Handbook and consistent with the Universal Declaration of Human Rights, the International Covenant on Civil and Political Rights, and the Convention Against Torture and Other Cruel, Inhumane, or Degrading Treatment or Punishment. Finally, they include current regulation and practices used by state correctional facilities, FEMA, and the Centers for Disease Control and Prevention, amongst others. These standards are consistent with the humanitarian principles that ensure the basic conditions for a life with dignity. The Humanitarian Standards for Individuals in CBP Custody Act takes a comprehensive public health approach that includes health screenings that include an interview and questionnaire with translators, basic vital signs, a physical examination, and having an emergency care provider on call 24/7, measures that will help prevent mistakes and future deaths of children at the border. My bill also includes standards on water, sanitation, and hygiene. Simple things like providing toothbrushes, diapers, enough latrines, hand washing stations, having the chance to bathe at least once a day, and meeting everyone's basic daily need to drink enough water. It includes standards for food and nutrition to make sure that women have enough calories to sustain them, that infants have formulas, that babies have baby foods, common sense things, and that there is food that the elderly can eat. In terms of shelter, my bill will ensure that people have just enough space for dignity, that the temperature is not freezing cold, and that they have appropriate bedding. Finally, my bill addresses surge capacity, requires humanitarian standards trainings for our agents, and directs the Office of the Inspector General and Government Accountability Office to report to Congress on CBP's compliance with these standards and its treatment of the families in its custody and under its responsibility. These are basic, straightforward reforms essential to protecting the health and safety of our agents and the women, children, families, and seniors in their custody. These standards will ensure our treatment of children and families consistent with the principles of basic human dignity. Passing This bill is how we will bring humanity back to our treatment of women, children, and families seeking asylum and prevent needless loss of life. With hard work, humanity, professionalism, and with respect for human dignity, we can put an end to these senseless tragedies once and for all. Thank you. And now I would like to introduce Leader Steny Hoyer to deliver a few remarks.
One of the strengths of the Congress of the United States is the diversity of experience and disciplines and expertise that our members have. I am proud to join somebody who has had firsthand experience in dealing with medical challenges in an emergency setting. The fact that he visited the border and you saw not only his intellect but also his heart, his emotion, his feelings. I would think that almost every American would say, that's what I want in my representatives. That's what I want our country to be, a country with a heart who sees itself as a humanitarian country, as a protector of people. I want to thank Dr. Ruiz for introducing this critically important legislation. As he said, 7 children have died at the border. That ought not to happen. That is unacceptable, and it's inconsistent with who we are as a country. The migrant families coming to our borders and seeking refuge ought to be treated with dignity and respect and humanely. Sadly, we are finding that they are instead met with inadequate care, housing, and nutrition. We're seeing children left in vans overnight while waiting to be reunited with their parents. Dr. Ruiz's discussion about the plight that he saw as he walked down the halls and looked into the windows was one that too many of us have seen. So it was not an isolated incident of which Dr. Ruiz speaks. We are witnessing migrants crowded under a bridge as shelter and forced to stay there day and night. We're hearing migrants being forced to live in ice boxes with nothing but a foil blanket to keep warm. That's not America. That's not what our people would want to see happen to their child, to their wife, to their husband, to their son or daughter. This is wrong. Unacceptable in America. This must not go on. The legislation introduced today by Dr. Ruiz and co-sponsors, which I am proud to support, would help ensure that the United States is meeting basic humanitarian standards. I think you're going to hear that phrase a lot. Basic humanitarian standards. I can't believe there's a citizen in America or a person in America who would say they did not have the expectation that their country would meet basic humanitarian standards. That's who we are. I thank Dr. Ruiz for visiting the border and using his medical expertise to put forward this legislation. And I commend the entire CHC for its leadership on this issue. I know that Assistant Speaker Lujan has been a leader in this effort as well. I know that so many behind me have been. And I want to thank, on behalf of the House leadership, all of you who have been taking time to come here and to speak to the American people of that of which you know, because I am convinced if they have the knowledge, they will demand action to meet basic humanitarian concerns. At this time, let me yield to the Assistant Speaker, Ben Ray Lujan of New Mexico.
Thank you, sir. I also want to recognize the work of our Majority Leader, Steny Hoyer, for his advocacy, for his voice, and his strong support of making sure that we treat everyone with the respect and dignity that they deserve, and especially these young families that have been fighting for their lives, escaping violence, only to be found and torn apart by this administration. I want to thank Dr. Raul Ruiz and the work that he has done. I had the honor of being on a trip with Chairman Castro, members of the Congressional Hispanic Caucus, and with Dr. Raul Ruiz when we were asking questions about the medical treatment or the lack thereof that people in detention were getting, that asylees were getting. And Dr. Ruiz had a paramedic open up their bag of medical equipment, and every question that Dr. Ruiz asked, there wasn't an answer. There weren't enough equipment that were sized for infants, little babies. Only the eye of an emergency room physician, someone with Dr. Ruiz's expertise, would have identified what was missing from the equipment. And it wasn't that the paramedic did not want to provide these services. Paramedic just wasn't given the tools and equipment required. That visit translated into Dr. Ruiz's legislation the importance of making sure that we're treating everyone with basic humanitarian treatment. How novel is that an idea? Treating people like people. Welcoming strangers. Not tearing children apart from their families. Children who are being forced to sleep on gravel beds with the indentions of those rocks in their faces, where you've seen the images where some of them have even been left bloody. Concrete floors with foil beds, no running water, exposed toilets, as you've heard from our colleagues, overcrowded cells. When we've gone to visit those facilities, it was only by asking permission to do so. And even when we were in those facilities, in those holding cells, we were told by the Department of Homeland Security personnel not to talk to the families, not to talk to those young moms and to those children, to stay away from them. This piece of legislation corrects that as well, to ensure that there is proper oversight, that the OIG can go in, that members of Congress can go in, that we can make sure we have conversations and ask if people are getting the support that they need. This is something that should be embraced by all. And again, as I thank Dr. Ruiz for the work that he is doing, I ask the question, why is a piece of legislation like this even needed? A piece of legislation to remind the United States of America that there are basic humanitarian standards that we should follow and put in practice. And I want to now turn this over to a friend of all of ours, a champion on so many important issues, the distinguished chairman of the Congressional Hispanic Caucus, Joaquin Castro.
Thank you, Ben Ray, and thank you everybody who's here, most especially to cover this very important issue. Thank you to Raul Ruiz, Dr. Ruiz, who has taken the initiative to establish for the United States basic medical and humane standards of care for migrants. And as Raul had mentioned and Ben Ray mentioned, the suggestions originated with a trip that the Congressional Hispanic Caucus took to New Mexico, and we retraced the area where one of the young migrants, Jacqueline, died. And it was clear when we visited New Mexico and those CBP facilities that they were woefully underprepared to handle medical emergencies, that they were unprepared to properly feed and shelter migrants who were arriving and asking for asylum. Something that sticks out to me from the explanation by the agents was that for those hundreds of people that came one night seeking asylum, all they had was granola bars and frozen burritos. And remember, you've got young children, some of them infants that are coming, people that have been on a long trek. And so Dr. Ruiz took the initiative, working with many of us and also with experts in the field, including some of the folks here, to develop basic medical and humane standards of care. So as chairman of the CHC, I'm very proud of his work, very proud that one of our members could lend such important work to this issue, which of course is even larger than this. It's especially important right now because we are in a perilous time for folks who are seeking asylum in the United States. During the Trump administration, in ICE's custody alone, 24 people have died, and 6 children have died in government custody during the Trump administration. And conditions seem to be getting worse. And there has been an element of cruelty to the way that this administration has gone about handling asylum seekers. And so I hope that the House of Representatives and also the Senate after us will send a strong message that the United States, the strongest and most prosperous nation on earth, is one that will treat humanely those folks who come here seeking refuge, fleeing desperate lands. So Raul, I want to say thank you for all of your incredible work, and we're behind you. And next, I think Zoe is running late. So the next one will be, the next speaker will be Dr. Falusi of the American Academy of Pediatrics.
Hello, my name is Dr. Lonray Falusi, and I'm a national spokesperson for the American Academy of Pediatrics and a practicing pediatrician here in Washington, D.C. The American Academy of Pediatrics is nonpartisan and pro-children. I'm grateful for Dr. Ruiz's leadership in introducing this bill and for Representatives Hoyer, Castro, and Lujan who are showing their support today. I would also like to acknowledge my colleagues, practicing pediatricians here in the D.C. area who are standing with us. All of us can recognize that we are in the midst of what has become a humanitarian crisis on the border. We are in crisis because children are dying on our watch. We are in crisis because the conditions children are being exposed to when they arrive at our southern border are dangerous and in many cases harmful to their health and well-being. We are in crisis because the solutions being proposed by government officials would make the situations worse, not better. While groups like the American Academy of Pediatrics have been urging the administration to change its approach and pursue policies that would protect immigrant children and families, our calls have gone unheeded. We have called for training of Customs and Border Protection, or CBP, personnel who are on the front lines so that they can recognize the signs of a sick or injured child. We have called for increasing the numbers of pediatric trained medical providers at the border, and the AAP has offered to assist the CBP in this effort. We have said that it is unacceptable for CBP to separate children from their parents absent a court order, or for CBP to take away medication from children with chronic conditions like type 1 diabetes, asthma, or seizure disorders. And yet, these practices continue. The bill being introduced today by Dr. Ruiz requires minimum standards for children at CBP facilities, something CBP should have put in place already in anticipation of this moment. They are long overdue. Now let's be clear, children are not small adults, and their signs of illness are subtle. They need to be screened by providers who can recognize the differences between a mildly ill child and a seriously ill child. Security personnel are not medical professionals. The bill recognizes this need and would equip each location that houses immigrant children with licensed medical professionals specializing in fields like pediatrics. The bill also requires timely health screening and necessary treatment for all children in their preferred language, and that children have access to basic needs: water, sanitation, and hygiene supplies, adequate nutrition, and shelter. As a pediatrician, it scares me that children who are seeking safe haven at our shores are often not provided with these most basic of needs. CBP processing centers are no place for children. They include chain link fences that extend from the floor to the ceiling, lights that are on 24/7, frigid temperatures, and children and families lying on mats on the concrete floor with Mylar blankets. Children should spend as little time as possible in these centers, and in fact, no child should ever be detained. There's no evidence that any amount of time in detention is safe for children. And yet, the administration is attempting to roll back protections for children and families in custody and arguing that they should be able to detain children with their parents for weeks, months, or even years. Any action that prolongs the amount of time that children spend in federal custody will increase the risk of illness, injuries, hardship, and even deaths of children. The AAP is unwavering in our position to protect and support the health and well-being of all children and families, including immigrant children and families. And to do that, the federal government must rapidly increase child health and welfare expertise at the border, not subject children to detention, and stop separating children from their parents. I applaud Dr. Ruiz for his leadership in proposing to do in legislation what should have been done long ago. The tragic deaths of immigrant children who were in U.S. custody further underscore the need for urgent action in order to advance this bill. Thank you very much.
Next, I'd like to invite Congresswoman Zoe Lofgren, Chair of the Subcommittee on Immigration and Citizenship, up to speak, please.
Thanks very much. You know, years ago there was a member of Congress, Mo Udall, who once said, "Everything has been said, but not everyone has said it." And I think I'm at that phrase in the proceedings here, where the value of this bill, the tragic deaths of these children has been covered. I'd just like to say how fortunate the United States Congress is to have Dr. Raul Ruiz among its members. As a physician, he has the experience to understand what is the right prescription for the neglect of these children at our borders. I've visited, I've seen the overcrowding, I've seen situations where little children have no privacy, they're not warm, they don't have access to soap, to toothpaste, to nurture. It's really not acceptable. And so I am a wholehearted supporter of this bill. I'm grateful for Dr. Ruiz and all the medical professionals who rallied around this important step for our country so that we can hold our heads high and know that we're always treating children as they deserve to be treated. Thank you very much.
Next, I would like to invite Sister Quincy Howard from the Network Lobby for Catholic Social Justice.
Good afternoon. People of faith are the hands and feet of God all along the southern border. The children and families who find them are often fleeing violence and poverty and have endured long, treacherous journeys. They seek asylum and respite and should be met with care and kindness. Network and our faith partners long for a government with the will and the competence to show compassion to the tired, the poor, the huddled masses yearning to breathe free. We come today as a community in mourning. We are lamenting the loss of 7 children this year who have died in detention, and for all others who have been harmed by dehumanizing enforcement and detention operations that criminalize them for being desperate. And we're here today deeply grateful to Representative Ruiz and his colleagues for demanding to know why children are dying and for proposing strategies to ensure that not one more child, not one more person dies in U.S. detention facilities. Immigrants detained at the border must be treated humanely with access to health screenings, medical care, nutrition, water, basic sanitation services, or we will see more deaths. These people have a right to seek asylum here and have little to no choice, usually. We cannot deny the need and we cannot deny our neighbor. The desperate will continue to come, and the soul of our nation is revealed in how we treat them. The current humanitarian crisis requires us to impose guidance and oversight on CPB and its agents. If not, we're condoning the deaths that have already taken place in our facilities. And we're complicit in the deaths of future detainees. Continued detentions without basic humanitarian standards like these mean that our nation has chosen to institutionalize the neglect, the endangerment, the abuse, intimidation, and dehumanization of these most vulnerable, the widow, the orphan, the refugee. This is a national sin that won't escape judgment. However, we can still show contrition with laws like these that Representative Ruiz is proposing. Thank you.
Again, I thank you so much, Dr. Faluzzi, for speaking, and thank you, Sister Quincy Howard, for reminding us of that central calling of love thy neighbor, do to others as you want them to do to you, and that golden rule that is so important, and also that Matthew's chapter 25 and the end part where the great teacher said, you know, you saw me, you didn't feed me. You saw me, you didn't care for me. I was a stranger, you didn't welcome me in. And we want to make sure that we welcome, that we take care of, we feed the most vulnerable amongst us. So with that, I'll take a couple of questions, and then we'll do one-on-one questions. Yeah.
Is there any notion of including this in the border supplemental package?
Yes, there is. There's some notions on including this. In fact, the president is requesting $3.3 billion for humanitarian aid, and this is the blueprint of where that humanitarian aid can be spent. The same thing of we always do. We talk to those that are negotiating. I believe that Lucille Roybal-Allard, chair of the Appropriations Subcommittee, chair of the Immigrations and Citizenship, Zoe Lofgren, and Speaker Pelosi, you have the support of Majority Leader Steny Hoyer as well. So this is the response and the solution to the request that CBP has been making for some time now. Any other questions? If not, I'll take questions on one-on-one. Thank you.